One of the hard and difficult things in nursing is that we often are trained to be task oriented. And so many computer systems now focus on using these clickable buttons to say that a task is done or a task needs to be done. And then the task is completed and it's checked off. And so it's created this whole group of task oriented nurses. Another problem with that is that many people in healthcare still focus on only one component of the individual, and that is the physical needs of that individual. So if you're doing these tasks and you're completing these things to impact the physical needs, one of the big things to remember is that there are many other needs of the individual. For example, somebody can be taken care of in a health system, they can be put up for discharge, and they can be ready to go out the door. However, if they don't have the financial capability, if they don't have a job, or if they don't have any way of affording their medications, they're going to be right back in the door very soon. Another component of this is family life. Do they have a support system? If they have a broken leg or a broken shoulder, or they need somebody there at the house to physically help care for them, that's a totally different environment than them trying to do all of that on their own and then falling, injuring themselves, returning to the hospital. So family is a big component, or support system is a big component. Another big component of the holistic care of the patient is their spiritual needs, and whether these individuals would require spiritual care in the hospital or need a spiritual leader or somebody in their church or their synagogue to be with them after that they leave the hospital, or to pray with them while they're in the hospital. And this is very important to many people and is often overlooked in these daily tasks that are, again, often designed to take care of the physical needs of the individual. And a lot of the part of what nurses do is really centered around that physical component. However, really any of the other things I mentioned, the holistic care of the patient, can be brought into play at any time that they're in a healthcare facility. For example, they could be in the ICU, they can be ventilated, unable to talk, unable to communicate, and that might be the time when they cognitively are aware of what's going on, but they're very depressed, or they need family at the bedside, they need some support system at the bedside. Maybe they need to be able to write on a piece of paper or communicate in some other way. And they can't tell you that they're depressed. They can't tell you that they may be struggling with different thoughts of homicidal, suicidal type thoughts. So it's hard to justify simply physically caring for a ventilated patient and not thinking about all of the other components of their needs. So I want to encourage you, as you go about your daily life, if you're a nurse working in a healthcare organization around patients, start thinking outside of the physical. Think outside of the physical and think, what else does this individual need to really impact their care? Maybe they need community support services. Maybe they need to be told directions on how to get to the pharmacy. Maybe they need information about their medications or about potential side effects of taking certain medications together. Maybe you need to pick up the phone and call a family member and explain the discharge instructions so that they understand as well. Regardless of what it is, I want to challenge you in 2024 to take a little bit of time to care for more than just the physical needs of a patient. I promise it'll make a big impact.